Okay, hello everyone. Happy to see all of you in today's session organized by VODAN Africa and Asia. My name is Putu Hadi, and as you can see, I put today's agenda on the chat box. And as always, before we start the meeting, try to keep your mic muted during the presentation to prevent background noises. And if you have any question while the presentation is going on, so just raise your hand or just type the question in the chat box. So I will now hand over to Professor Francisca to lead the meeting. Professor Francisca, the floor is yours.
Thank you very much, Putu, and thanks to you and Aliyah for setting up this meeting today, as you have always done excellently. I say good afternoon. I'm not sure anyone is in the morning yet, to the members of our community, and welcome everyone to our regular Tuesdays meeting. Thank you for keeping the time and for being with us every Tuesday. As Putu already put the agenda in the chat room, but it's not different from what we usually do every week, to take updates from the different technical and organizational teams, and of course to also take questions and feedback from the other members of our community. To the country coordinators, if there is anyone who is joining us for the first time today and you would like to make an introduction, could you kindly put that in the chat box so you'll be called upon to make the introduction. While we wait, we'll take the update on the health facilities communication, and that will be given by Putu from the meetings of Mondays and the interaction with the different country leads. Putu, I'll yield the floor to you now. Thank you.
Okay, thanks, Prof. Francisca. I will share my screen. So based on yesterday's meeting, basically we have three type of question with in the communication with the health facilities. So the first round is about general overview, second round is about GDPR rule and data access, and the last round is about information flow and dashboard requirement. So basically from yesterday meeting, we always start from check the health facilities in each country. So right now from Nigeria we have 15 out of 21 health facilities. So I put from this list, I put the green dot. It means that we already communicated with the health facility, and the yellow dot, it means that we are still in progress with the health facilities. So now we have 15 out of 21 health facilities communicated, but we have 6 in progress. So I'm still waiting for the result from Abdullahi. And from Uganda, we have 2 out of 4 health facilities that already communicated for the all-off round of communication. But we are still waiting for the feedback from the Layantodi Hospital and Holy Innocent Children Hospital, and I'm expecting Mariam will give the reply of the feedback from these 2 health facilities. And from Kenya, we have 3 out of 4 health facilities communicated, but not all of the but still in the first and the second round. So not all of the health facilities communicated, and also we are still waiting from Pumwani Hospital.
Putu, we're not
yes.
seeing the other countries. We only have one slide, the evaluation ready, showing Nigeria and then Uganda, right?
How about now, Prof?
Yes, it's moving now. Thank you.
Oh, sorry. And then I will repeat it once again. So Uganda, we have 2 out of 4, and then we are still waiting from Liantodi Hospital and Holy Innocent feedback, and we are expecting the reply this week. And from Kenya, we already communicated with 3 out of 4 health facilities and still waiting for Pumwani Hospital. Maybe Dr. Reginald can explain what is the progress on the last session. But we are still in the first and the second round of communication. So we are still waiting for from the health facilities that still in progress with the first and second round and third round of communication topic list. And from Ethiopia, we already finished round 1 and round 2, and Abram sent me the list of health facilities that finished with the third round, but I'm still waiting for the result. So I'm still I still put the yellow dot here because I didn't get the result, but I will ask Abram about this. So basically, we are finished with the first and second round of communication. And from Somalia, we are finished all of the rounds of the communication, but we need one more from Somalia. But yesterday, Din Jamal told me that he will discuss with Prof. Miriam. Is it possible to add one more, or he stay with this number? But they are finished with all of the health facilities communication. And from Zimbabwe, Professor Bernard told me on yesterday's discussion that they are still Zimbabwe team still waiting for the clearance to go to the health facilities and ask the communication and make a communication, because they cannot directly go to the health facilities to do a communication about the project. And after I checked all of the communication with the health facilities, now I collected some result from several results from the health facilities about our question about the digital health, that current digital health in the health facilities. But before I summarize what happened in the health facilities, I checked all of the question answer by the health facilities. So right now I'm checking one by one from each country. So red field means there is unanswered question. So I should confirm with the coordinator to answer this question, because it is blank right now. And the yellow field means that there is unclear answer from the health facilities. So I need confirmation about that. So I put all of the result on the Google Drive, and I put a comment there to confirm what is unclear for me from the answer. And right now, Nigeria, I'm finished with the Nigeria evaluation, because 15 health facilities was finished the communication topic list, so I can make evaluation from the result. And this week I will move to Uganda. There are 2 health facilities that I can evaluate, and also from Somalia, because the Somalia also finished with the communication, all of the communication topic list. And I put all of the result, all of the health facilities answer in a Google Sheet, and also I put the document from health facilities on the link, and each coordinator know this, because I share this PPT from yesterday's meeting. So that's all, Prof. Francisca, that I can report today. Back to you.
Thank you very much, Putu, and for the excellent updates and for the work you're doing in your team of the communication with the health facilities. I remember yesterday some of the country coordinators spoke about the gaps. I don't know if Miriam Basaja is on this call. You should be able to provide some answers to the communication gaps with the 2 health facilities in Uganda. Miriam? I'm trying to check. I don't see Miriam on the call yet. And Professor Bernard to provide answers to the gaps also we have in Zimbabwe. We don't have those two on the call yet, but if they come in, we may want to hear from them on the progress they have made with the communications with those health facilities in their country, especially with Zimbabwe, where we don't even have anyone at all. It would be good to at least have some updates from the contact of the country coordinators with the health facilities. Next, you want to say something, Putu? Do you want to say something? Oh, okay, right. No. Thank you. So I think next we can speak to the team of Aliyah and Miriam. Miriam is not on the call, so perhaps Aliyah, you like to give the update on templates and vocabularies. And of course, if you have anything to say on CEDAR deployment, since Miriam is not here, and I know you're co-overseeing that, as well as on the work schedule that we had seen yesterday at the meeting of Mondays, which you oversee. Thank you, Aliyah. I'll yield the floor to you now.
Good afternoon, everyone. Thank you very much. So basically, if I speak regarding templates and vocabularies, we have received some comments on audit from John, and there are actually the work is good, but there are some changes that needs to be done in templates. So yeah, today we had a short call with DHIS regarding the vocabularies of A and C from Ethiopia. So basically we have discussed the errors that DHIS were having within the templates. So far it's good. So basically we work towards the comments provided by John. And if I speak regarding the deployment, so I would say there are some progress from the team. So last week we have received the instruction from Geto and Samson, and now team is still working on it, and there are some errors that the team is facing right now. Root 1 was able to deploy on Ubuntu. And now there are some discussion regarding the server side. So if he arranged to get the server, so basically we can make an image of the deployment, so and distribute the images through hospitals. So basically that's all from my side.
Thank you very much, Aliyah. Would you also be able to give an update on the schedule board which we're using? Because I remember we need some data stewards to undertake some of the assignment. Perhaps I've spoken to Professor Sakinat, but this may be an opportunity to get some of the data stewards to also contribute to that. Will you be able to share the worksheet? So give us a view on the worksheet.
Yeah. So basically, this is the timeline. So do you want me to start from the beginning, like from the CEDAR?
Yes, it would be good to give that update. Thank you, if you don't mind.
Okay, so deployment on Ubuntu, like making sure that all architecture components are running. It's on progress, starting from the July, and so far it's on the progress, and deploy as a server, as a web server. So it's one, and it's also in the progress. So maybe this week we can have updates regarding it. So then if I go to the onto portal, part on deployment and website configuration, which will be started by Oluwole this week. and he's going to make some configuration and also like the work like domain name, buying domain name and website configurations, and making sure that bioportal values, VODAN bioportal vocabularies are important to onto portal, and this kind of stuff will be done by Olawole, and connection with CEDAR. Yeah, this one connects CEDAR to onto portal. I think this will be done afterwards we finish the deployment part. So yeah, and then if Nurullah Saifettin is working towards the development part of the tool between CEDAR and HMIS that sends data into DHIS or HMIS. He's at the very initial points, so I think he needs some time to figure it out how the CEDAR works and how to generally make the coding itself. So this is something we do later on. Regarding the templates, I already give an update. So if I speak regarding Zimbabwean team, so I would say training has been given by Mariam to Kuda or Zimbabwean team, and they are working on it, and so they were given an assignment, and so the work is on progress. There are some delays from Liberian team, and I asked Wondimu to take part in the development of the templates. So he had answered me that he'll contact a nurse, but eventually a nurse, yesterday he updated me that there are some like, how to say, so there is no response from Wondimu's side. So I don't know, maybe Professor Francesca, you can escalate this process. So yeah, so that's it regarding the templates. Otherwise, everything is on the progress, and yeah, so far it's up to date. Okay, so if I speak regarding FTP and like hosting, like query running. So yesterday we had a call with Professor Dr. Sakinat, Mariam, and me. So it was initial call within the team. So yeah, I think we need some time to figure out how CEDAR-based FTP works and what to do next. But yeah, we'll have again the meeting this week, later this week. So, and regarding dashboards, yeah, I feel that I asked Rudwan to update this part, and he was actually saying that he will do that. So I hope that he can update this part later on, and that this is access and control. So Putu already gave an update. Data storage. I would like to ask maybe Akindele or Kau give us updates on this one, because yesterday there were no one on the call. Let me see if Akindele or Kau is on the call. I don't see them. Mr. Akindele is here. Maybe Mr. Akindele can give us any thoughts regarding that.
Yeah, thank you, Halia. Good afternoon, everybody. Yeah, on the data storage servers, I have not yet had any contact with Kawu or Rudwan, but I'll do that today and I'll give you feedback directly. Thank you.
All right. Thank you, Mr. Akindele, for the feedback, and also thank you, Alia. Are you still continue, Alia? Yes, please.
Yeah, so, and then as I mentioned previously, training by Mariam was given, and there was additional task regarding processing unique identifiers, and yeah, Josette has started to work on it. So, and tomorrow we'll have a separate meeting where we identify the certain task regarding this part. So basically that's it from my side.
Thank you very much, Alia, for the excellent and detailed updates. And you're actually doing a lot. And I will also want to like to thank the data stewards and the members of the community that are supporting you. I was going to call Dr. Wondimu to give an update on Liberia, but I think he already typed his update on the screen that he had problem with it.
Prof.
Yes, yes.
Hello, Prof.
Yes, yes.
Okay, good afternoon. Sorry for the inconvenience. You know, I lost my phone screen was failed, so you know I don't have a WhatsApp and you know contact for Ernest, so that's why I couldn't contact him this week. So I'm trying to fix it, and then immediately I will try to call him. Maybe I will be visit JFK Hospital and then I will talk to him. Sorry for the inconvenience.
All right. Thank you very much, Dr. Wondimu.
So I think using this opportunity, I would like also to update from Ethiopia side already. Putu mentioned that the third communication is already done, and then FM is working on the data analysis. Once he compiled the document, then he will share with Putu the final one. So this is a brief update from our side. Thank you. Over.
Very much, Dr. Wondimu. Thank you for the update. So that is taken. And then Mr. Akindele already also gave the updates. We hope they're able to get a time together with Kawu and Rudwan and decide on the best offline storage that that will be best for the project. Yesterday at the Monday meetings, Rudwan gave an update on the dashboard per se, that he's very busy. Of course, he's doing the deployment and the NIH call, and he was requesting for people to volunteer so that he can actually tell them what to do. I don't know. I had contacted Dr. Sakinat to get data stewards from Nigeria, but I don't see her on the call right now. And it's more of a systems thing. So I was thinking Engineer Elijah Joseph, for example, may want to be part of the dashboard team. Engineer Elijah, is it okay as I've nominated you to be on the dashboard with TGIS?
It's okay. It's okay, Prof.
Thank you. So I will communicate. Aliyah, if it is okay, maybe you do an email to connect Engineer Elijah Joseph. We'll get the email, and Rudwan with TGIS so that Rudwan can give some advisories on what they're expected to do, and then they can start that. We may be able to get additional data stewards to work with them. But at least it's good for us to get that aspect started, if that is okay, Aliyah. Aliyah?
Yes, sure. It's Rudwan to connect with TGIS and Elia, right?
Yes.
Okay, great.
Thank you, because Rudwan already has an idea on how to go about the dashboard, but then he says it is so much, he has a lot on his hands. But if someone will be happy to take that off his hands, he can give the instruction on what they need to do. And I think that is fine. So if he gets 2 people, if there is need to train more people, but at least if TGIS and Engineer Elijah already, because it's more of a systems configuration thing from what Rudwan was saying. And then we may have to train more people. But for now, let us get it started with those 2. We may get some other people to volunteer to join later. Thank you very much. Dr. Wondimu already gave the updates on Liberia and of course, Ethiopia. I saw that Professor Bernard joined the meeting while Aliyah's presentation was ongoing. Professor Bernard, would you like to give an update on Zimbabwe? We were looking at the communications update from Putu, and there has been no communications with the clinics in Zimbabwe yet, according to Putu's records. Maybe you would like to update on that.
Yeah, I attended, yes, thank you very much. I attended yesterday's meeting where I gave an update on the issues regarding the Zimbabwean situation, where we approached the provincial minister so that we can get a recommendation letter to the Medical Research Council of Zimbabwe, because the provincial medical director confirmed that he cannot approve that for us to get the go-ahead to make use of the local clinics and 2 provincial hospitals that we intend to make use of. So yesterday we got the recommendation letter from the provincial minister, so that we get access to the Medical Research Council of Zimbabwe, so that we, after approval, we can make use of the clinics, the local clinics that we have, and also the 2 provincial hospitals that we are having. But however, KUDA has confirmed that for the Medical Research Council of Zimbabwe, we need $500 for approval. And I communicated with Professor Miriam in regards to that, and he confirmed that he's going to assist KUDA in that regard, so that that exercise will be done in a pace which would allow us to catch up with other countries. I'm realizing that Zimbabwe is far way below other countries as far as the progress is concerned. The challenge that we are experiencing is that they are taking this information as something which is so sensitive. So it has to be treated with care, and we need to go through all the protocols that it deserves, so that we may not experience some challenge with regards to the way we handle this project. So that's where we are now. And KUDA is finalizing the template with the lady who is up there, so that they can quickly make a submission as far as the template is concerned. So this is the update that I'm having at the present moment. Thank you.
Okay, thank you very much, Professor Bernard. And I would like to also commend you for all the efforts. We, right from inception, even at the proposal level, and when we have to defend this with Professor Miriam, the VC, Beth and I, when we defended this project with the FMO, we identified that Zimbabwe is not going to be very easy. So we're actually proud of the progress you have made so far. And I want you to know you're not as behind as you thought. Now, KUDA, the ethical clearance has been obtained at Tilburg. And of course, now you also have this approval, and the templates training has been done. And KUDA is creating the templates and the vocabularies. So you're not as far behind as you thought. It's actually us now, we need to update our records to show more progress in Zimbabwe. And then as soon as the communication starts, Putu will also be able to update his records. So I would like to thank you very much, and your team. It's just you and KUDA for all the efforts you have been making on the project. Thank you. Ali, I scanned through the chat and I saw that Seth had also volunteered to join on the dashboard. So if you'd like to also note that down so we can include him in the email. Seth is from Kenya.
Yeah,
so we can
added him. Thank you, Prof.
Thank you, Aliyah. Thank you. So we move on with the updates. Dr. Wundimu and Dr. Bernard, Professor Bernard, I beg your pardon, already given the updates. So can we have updates from Kenya, from Somalia? I'm sorry, Din Jamal is here on the call. If Din Jamal would like to give an update on Somalia, Din Jamal, please. Okay, I don't have Din Jamal on the call yet. Maybe it dropped out. So we can move on to Kenya for Dr. Reginald, the country update from Kenya. Dr. Reginald?
Yes, thank you, Professor.
Yes, Dr. Reginald, in addition to that, perhaps you also like to give the update on the country coordinators team, which you are now coordinating the meeting of the country coordinators. If there are some reports from that group as well, it will be a good time to give it after the Kenya update. Thank you.
Yeah, thank you, Professor. The update here is that we have 4 health facilities. One of them is government made, that's Pumwani, and we have government bureaucracy, which we are working with. Then we have KEMRI, which is the Kenya Medical Research Institute. They're very much on board. This is the government voice in the area of data collection. In fact, the director already gave a recommendation letter to work with VODAN in the new project. So I would just put you to be patient with Pumwani, because Pumwani is a catchment that holds almost 300 other hospitals under it. And the government is monitoring to see how we find our entry there. And so if we get Pumwani, we'll have captured a lot of data. So tomorrow we are still having a meeting with Nairobi Metropolitan Service to discuss how they can be involved with VODAN and especially with the Pumwani. Then the other question we are discussing now is the national policy on data privacy. I think during the day we had a discussion also with Professor Miriam on what they mean by data subjects. So there is a bill that has gone before Kenya Parliament addressing the question of data privacy. So we're trying to see how that connect with what we're trying to do with the VODAN in the area of CEDAR localization. I think what the government is trying to say is that, yes, we can collaborate, but all the Kenya data must be stored locally. So this is what the research I'm working on now, and also thinking through with the Center for the Commission for Data. The Commission for Data Management in Kenya was created last year. All these people were in harmony with them. Then about the last question, Professor, we have this coordination of all the coordinators from different countries. This is where we discuss on points raised by Professor Francisca and Professor Miriam that require a more detailed approach. So one of the questions that has come out is VODAN Africa to collaborate with Stanford University and National Institute of Health, the US. So the first part of it has been to collect CVs from all the coordinators so that a report can be written. Then the second part has been to get letters of recommendation from each country, like for example, Minister of Health from each country, or big research institutes like Kenya Medical Research Institute, to support VODAN in applying for this collaboration. So as we're speaking now, Professor Miriam is in the middle of writing the final report. Thank you, Professor. That's what I wanted to say.
Thank you very much, Dr. Reginald. Thank you for the excellent work coordinating the country coordinators, and of course for coordinating Kenya. Thank you for everything you have done to interface with the health authorities and of course with the health facilities as well. We're hoping for more positive reports from that country, which is one of our key support countries in this second phase of the project. I think Miriam just came in while you were speaking. So I'll give Miriam a few minutes to settle in while I call on Dr. Sakinat, if Dr. Sakinat is on the call, or Dr. Abdullahi to give a report for Nigeria. I'm looking, oh yes, we have Dr. Abdullahi. Dr. Sakinat is not on the call, but we have the alternate chief for Nigeria, Dr. Abdullahi Ibrahim, to give a report on Nigeria. Dr. Abdullahi.
Thank you, Prof. Francisca, and thank you, the whole team. Glad to be here again, as always. From the country activities, health facilities, vocabulary, and dashboard, where we have been keeping a close tab with Putu. So he gave us some of his observations, which we're actually working on them to make sure we fine-tune the things we answered on the facility interviews. Then on the second part, which is headed by Dr. Reginald, we are also pushing from the Nigerian team to talk with the big organizations for the recognition and recommendation letter. So hopefully between the end of this week and next week, we hope to have the positive response. Thank you so much, man.
Thank you so much, Dr. Abdullahi. I just try to remember something now. There was a question with regard to the NIH call that was posed to the different countries, that on the average, what would you think is the number of patients per clinic per month that could be in the OPD register, outpatient register, and maternal child health? I think, I don't know if Dr. Reginald or someone can help me post that. It's a very important question that we want to get from the country, that we want to get from the countries. If you can get an average, and then we pass that on to Professor Miriam. I'm going to post that question. So the country teams, I wanted to call Dr. Garaku from Nigeria to get an average, because he's also not just in Northern Africa, but he's part of some national health organizations. I've put the question in here in the chat box, right? On the average, what would you think is the number of, yes. So if you can get some average per country, then we can get an average per project for the entire project and put in the NIH course. So for whoever is able to get some of these answers can private chat me on WhatsApp or some other way of sending it across to me. Then we aggregate and or send to Dr. Reginald. He's actually coordinating this. But I remember now that this would be a good opportunity to get the answer to this question or something close. Thank you very much again, Dr. Abdullahi. Thanks to you and Dr. Sakinat and all your support system in the Nigerian team for all the excellent work that you are doing. It's good to have this very good report. I don't have Dr. Jeremiah on the call yet for Tanzania, but I have Professor Mariam from Tunisia. Professor Mariam, perhaps you want to give an update on Tunisia, and then especially on connecting our project on health data with the Tunisia project on research data. If you'll be able to give a brief update, please, Professor Mariam.
Thank you, Professor. Good afternoon, everyone. So we have mainly 2 points to highlight. We're still working in the entry of metadata in CEDAR templates. And I think that it will be helpful for the queries test when we have to deal with this part. And the second point, we tried to install the CEDAR in Ubuntu also, but we have some errors. We will share some screenshots with the group in WhatsApp to have some advices how to deal with these errors. That's all. Yes.
Thank you very much, Professor Mariam. Yes, if you send a screenshot of the errors, we might have people be able to help, like Tigis, Aliyah, Mariam, and VODAN, of course. And if neither of them could help, we can take it to the team of John. But I'm almost positive that our own team of technical people on CEDAR might be able to provide some insight. Mariam, would you be happy to give an update on the deployment? I know Aliyah already gave some overview or general updates, but you may be able to give a more specific update on the deployment being done by Rudwan, Oluwole, and the Tigis, and of course, Nambobi. Mariam Basaja? Let me see. Is Mariam still on the call? She came in earlier. Okay, I think Miriam already dropped out of the call. But I can speak briefly on that. Remember, about the last 2 meetings, we took a decision to have some, because of the situation in northern Ethiopia, Getu and Samson have not been so communicative as frequently as we wanted. So we wanted some members of our community to work on the local deployment. And we had Nambobi, Tigis, and Oluwale to work on different platforms. While that was going on, Gateway and Samsung were able to send because the original documentation for the CEDAR local deployment is in Mac, but Gateway and Samsung were able to sign the documentation for Ubuntu, and I know the team has been working. I know Nambobi has had issue with storage, but those are being resolved. VODAN has successfully deployed locally on his PC and is trying to, with Professor Miriam, to get a server space at the LUMC so he can deploy at LUMC. And then from there, we also have one in KIU for Africa. Hopefully we should get that in the next 1 or 2 weeks and we'll be able to give a report. But Miriam would have been able to give more details of the report. Otherwise, everything else is going so well. I guess that's all about reports. If there is no other one, before we take the questions on AOB, I would like to specially welcome Beth Mema, who has been with us, Beth of GoFair Foundation, which is like our technical head of technical partner. If Beth would like to say 1 or 2 words to the members of the community, we haven't heard you speak in a while, and we'd like to hear from you and from the GoFair. Beth?
Yes, thank you very much, and good afternoon to the entire team. As I said earlier, I'm very impressed by all the work that has been done. I also saw recently, I think it was this morning, another newsletter update from our friend Obina. And I felt again that it was a very good, let's say, intermediate report explaining, what is happening and all the achievements that were made. So my feeling is that let's carry on with it. I can see that we made huge steps, and I hope that we will continue in this pace forward. And I'm looking forward to next updates and to next achievements. Thank you very much.
Thank you very much, Beth, and we really appreciate your support and the support of the GoFair Foundation in providing a lot of technical backbones for the project and for the members of our community. We're truly grateful. Before I hand over to Putu and Aliyah, I would like to thank every one of you and ask Putu and Aliyah to moderate the AOB and Q&A before they bring the meeting to a close. Putu, Aliyah, please. Thank you.
Thanks, Professor Francisca. And before we close the session, is there any feedback or comment, or any other business that want to state in this session? If Professor Francisca, and how's the progress of FAIR special journal? Is Nisha is here, or Dr. Saktinat, or can you update about that, Professor Francisca?
Yes, the update on that is just pretty straightforward. We opted for the peer review, and that is still ongoing, right? Okay. The peer review process is ongoing. We're yet to receive the review reports from the experts that are reviewing.
Okay, thanks, Prof. And okay, I think there is no more question or feedback. Then I will close this session for today's meeting. So thank you everyone. As always, the video recording of this session will be uploaded on the weekend on the WhatsApp, on YouTube, and also in the Slack channel of VODAN Africa. And thanks again for joining us. We will see you next week in the same session. Thanks, everyone.
Thanks, everyone, and goodbye. Thank you, Putu. Thank you, Aliyah. Bye.
Thank you very much.
Thanks, everyone.
Thank you.
Bye.
Thank you. Thank you very much. Have a nice day.